you see clavicle is a long bone, so it has a medial end or sternal end and lateral end or acromial end, and it's located here on the superior part of the thoracic wall, horizontally, slightly horizontally, and it has an S shape. It has S shape here, you can see. As you see here, the sternal end articulates with the sternum. That's why it is called the sternal end. And the acromial end or lateral end articulates with the acromion process. Here is the acromion process of this bone, scapula. So here is the sternal end, here is the acromial end. So how to identify these two bones? You see, as you see, the acromial end, the sternal end is large and rounded, but here's the acromial end, but sternal end, here's the acromial end or lateral end, which is flat. It's not rounded. You see, it is completely flat. And as I mentioned before, it has a S shape, medial 2/3 convex anteriorly, but lateral 1/3 convex posteriorly. Here you can see medial 2/3 convex anteriorly, lateral 1/3 convex posteriorly, and the weakest spot of the bone is between these two, between the medial 2/3 and lateral 1/3. Maybe it gets fractured. So it also has two surfaces. It's a superior surface, and here is the inferior surface. As you see, the superior surface is smooth. There is no marking or immersions of the muscles or ligaments. But if you look at accurately to the inferior surface, you can see some markings of the ligaments next to the sternal end and also next to the acromial end, and there is a groove here. So this marking under the sternal end is for the ligament. There is a ligament here between the costal cartilage 1 and the inferior surface of the sternal end, which is called Costoclavicular ligament. Cost means rib, clavicle, Costoclavicular ligament. So there's impression here. And here we have a impression on the anterior inferior surface of the acromial end. You see there's a bony bit here and there's a line here. So we have a ligament here between this process and the acromial end of the clavicle, which is called Coracoclavicular ligament. Here you can see the clavicle, acromial end of the clavicle, and here is acromion. Here is the joint, which is called Acromioclavicular Joint, and here's the scapula, and this process is Coracoid Process. Between the Coracoid Process and the acromial end of the clavicle, we have a ligament, Coracoclavicular ligament. It has two parts, you see. Here's the one part, conoid part attaches to the conoid tubercle, and trapezoid part attaches to trapezoid line. So here on the inferior surface of the acromial end of the clavicle, we have this bony landmark. This is a conoid tubercle, and we have lateral to the conoid tubercle, we have trapezoid line for the Coracoclavicular ligaments I showed you. And inferior on the inferior surface of the middle part of the clavicle, we have a groove. This groove is a groove for the muscle which is called subclavius muscle. I'll show you the subclavius if I find it. Okay, I'll show you later. There's a muscle here between the rib 1 and the inferior surface of the clavicle. So subclavius, sub means under, subclavius muscle here. And here is called sternoclavicular joint or SC joint, sternoclavicular. Here is the acromioclavicular joint or AC joint. See, here is the AC joint, here is the SC joints. Thank you.